This is a podcast of the Nuffield Department of Medicine. Dr. Raghib Ali talks about INDOX, the cancer research network in India.
Hi Raghib. What is INDOX?
So INDOX is a collaboration between the University of Oxford and 12 leading cancer centres in India. And it was established in 2005 really to establish a partnership with colleagues in India and to develop common research protocols to look into common cancers in India.
Why do you conduct epidemiological studies and clinical trials in India?
So INDOX was established with three main aims. One was to develop affordable treatments and effective affordable treatments for cancer in India. And the second was to try and improve the detection of cancer, the early detection of cancer, because people tend to present very late when it's too late to treat them. And the third is to try and reduce cancer incidence by establishing the risk factors that are important in that population. So clinical trials really help us with the first of those aims, which is to find new treatments and effective treatments that will be affordable to most people in India. And the epidemiological studies are really to look at the risk factors for common cancers in India.
What are your areas of interest?
My main area of interest is in colorectal cancer or bowel cancer. And we're really looking to see if we can find new risk factors for this cancer. So colorectal cancer is the second most common cancer in the UK, in Europe and most of the world now. And we believe by looking at colorectal cancer in India, we can discover more about the risk factors that are relevant there.
What are the most important lines of research that have developed over the past 5 or 10 years?
So for example, with colorectal cancer, there have been studies in the West that have shown conflicting results with regard to whether vegetarianism protects against colorectal cancer or not. In India, you have about 20% of the population that have been lifelong vegetarians since birth. And they don't do it for health reasons, they do it for religious reasons. And so we're interested to see if that will decrease their risk of colorectal cancer. They also have a habit of chewing tobacco as opposed to smoking tobacco, particularly amongst women. And again, we'd like to see if that might increase their risk of colorectal cancer. The other main study we're doing is looking at aspirin in the secondary prevention or treatment of colorectal cancer for people that have had their tumours removed. So there's been, again, indirect evidence from studies in the West that suggest it may reduce the risk of colorectal cancer coming back. So we're now conducting the first proper clinical trial to answer that question in India and other countries in Asia.
And why does your research matter? Why should we put money into it?
Cancer is increasing worldwide, but particularly in India, the number of cancer cases is already 2 million a year, and it's projected to increase to 3 million a year over the next 10 years. So there's a huge number of people that could potentially be afflicted by cancer, and we believe that through research, we can reduce that burden of cancer and reduce unnecessary deaths and suffering from cancer.
How does your research fit into translational medicine within the department?
Looking at colorectal cancer, the incidence in India has historically been quite low. And it may be something to do with vegetarianism, but it may also be to do something within their diet. The spices, for example, that they eat, some of them act like aspirin, and it may be that those spices will reduce their risk of colorectal cancer. And so if we can isolate within their diet what spice, for example, is protective, we could turn that into a medicine, and that could be used in all populations to reduce their risk. With our aspirin trial, aspirin doesn't work in everybody, and by looking again at the genetics of the people who develop the cancer and their tumours, we can see what type of patient is protected by using aspirin and which are not. And so we don't have to unnecessarily treat people that will not benefit from aspirin and avoid unnecessary side effects.
Thank you.
Thank you.